Hi, I'm Dr. Naveen Kella at the Urology Place. I'm excited to talk to you about some of the clinical research that we're doing here, particularly a study comparing two FDA approved treatments for BPH, iTind and UroLift. It's sponsored by Olympus, the maker of iTind. And this is really the first trial that I can think of that's looking at two FDA approved studies, both of them on the AUA guidelines, and comparing their safety and efficacy over a 3 to 5 year time horizon. This is the MT08 comparative clinical trial, and it's here in San Antonio, Texas at the Urology Place. Basically, this is a landmark study. It's a head to head study comparing UroLift with iTind. This procedure with iTind is done, it can be done in the office or in the operating room. And iTind basically is placed in the prostate and it creates a new channel. It reshapes the prostate and it's done over a course of 5 to 7 days. At that point, this device is removed in the office. That's a very quick procedure. And then patients really typically immediately start feeling the benefits of getting off medications. These medications, like Flomax and finasteride, have lots of side effects. The other treatment is UroLift, and UroLift is also FDA approved, also part of the guidelines, and it uses tiny permanent metal clips to mechanically open up the urethra, as you can see here in this column, this cartoon. And when you pull open the prostate, it allows the bladder to push the urine through with less resistance, and patients can urinate a lot better with sustained relief. It's also very quick. Both treatments don't really have sexual side effects such as erectile dysfunction or ejaculatory dysfunction. Really, with these types of therapy, you can get off daily medications, which is be a great benefit of having a procedure like this, because these procedures also allow you to get back on your feet quickly and maintain your lifestyle, protect your sexual health, and get you quickly back into your normal activities. And the study, one of the best things is that this study is done where financially almost everything is covered for the patient. For iTind, 100% of the study is pretty much covered. The procedure, there's no financial worry about having to pay your copay or your coinsurance, or if you have a large deductible, coming up with the money to go through the procedure. And even with the UroLift arm, the company is actually sponsoring a large portion of this where the costs should be insignificant. Again, this is a randomized study, so the patient's not going to have a choice. So, really, this study is remarkable in the fact that patients can get these treatments nearly for free if they're a candidate. They're looking for a few things, basically over 50, an IPSS score, which we'll check in the office. The patients have to have a certain shape with their prostate gland, and we need to rule them out for any prostate cancer if they have an elevated PSA. Again, just to summarize, iTind and UroLift, both FDA approved. iTind is temporary, 5 to 7 days before it's removed. The UroLift has permanent clips that open up the urethra. They both preserve sexual health, including ejaculation, which is really a big drawback for medications like Flomax and finasteride, which can impede libido, and a lot of other BPH treatments which affect ejaculation. The coverage, if the patient's in the study, again, the biggest benefit right now, in my opinion, is that a lot of the costs are covered for these two FDA approved treatments. Both of these could be done in the office setting or in the operating room. So, really excited again about having this study offering these two treatments here at the Urology Place. We're in San Antonio, Texas. If you have patients who may be interested, feel free to let us know or have the patients contact us at our website, which is www.theurologyplace.com, or you can see our email here as well, messages@theupi.com. Thanks again, and really appreciate your time, and hopefully you'll find this information useful for yourself and your patients.